what a typical population goes through in terms of a clinical pathway. For me, I want my clinical pathway when I get ill to be customized to me, to how I live and to what my situation is and to what my preferences are. And I think, therefore, we're on this kind of journey from, medicine as an art to definitely medicine as a science, right down to the individual personal level of treatment. So what about, how do people feel about healthcare records and being involved in healthcare decisions themselves? Here's a recent survey. I think it needs to be updated, but 2006 showed that 90% of citizens want to be more involved in managing their health. There's probably no great surprise in that statistic. 52% want to make final treatment decisions for themselves or a family member. Okay, so that means in some cases, in most cases, in fact, people want to essentially be able to override what the healthcare professional is recommending. They want to make final treatment decisions for themselves or a care or family member. 38% want to make decisions together with their doctor. And this is very interesting because this is about changing the doctor-patient relationship and the idea that it's already happening. Maybe many people in this room have gone through this experience where you develop some symptoms and the first thing you do is you go to Google and you look up the symptoms on Google and you start analyzing what's available out there, and then you take a big bundle of printed paper to your doctor and you sit with your doctor and say, this is what I think is the problem, what do you think? And it's much more of a kind of a collaborative discussion rather than, I'm sick, can you kind of work out what the problem is? And I think people are becoming more and more motivated to do this for themselves. In 2004, half the population of the US went online for health information, which was a tremendous rise from just 6 years before. And I'd be surprised if that figure is not now nearer to 150 million people in the US. And I think this is true for most developed economies. In 2005, 80% of internet users searched for health information. And 72% of citizens favor establishing a national electronic health information exchange, and 60% a secure online PHR. I should just define what I mean by PHR at this point, which is a personal health record created by an individual and used by an individual. So this is not, if you like, a record that's created by somebody else for you. This is your own personal health record. So I think this illustrates there's quite an appetite among the general population for getting more involved in health decisions and health information. And we think that if we're going to get people to be more responsible for their own health, we have to start making better health-related choices. We have to receive much more personalized, high-value care from the system, and we have to start improving financial planning for healthcare. So you might end up with the concept of, let's say, a health coach, someone, and this may be yourself, of course, but someone who will help you to kind of predict what your risk factors are and to help you navigate through your health choices. And that may not be your GP. Today, very often it is your GP, but how much time do they really have to do that? You may also have a value coach, someone that says, okay, given your risk factors, here are the health services that may be relevant to you, the insurance policies and the benefits you may want to go for. So the idea of having a health coach. And then a wealth coach, because health is not cheap. And I think as more people want more choice and begin to take up more kind of the option of private health care, I think we're going to have to start thinking about how do people decide what's best for them using professional advice in the same way as they do today if they're going to buy financial instruments like investment or stocks and shares or pension plans. And all of this, of course, requires much better access to information. Okay, so let's talk briefly about the evolution of eHealth and where this kind of network edge fits in. We're all very familiar with the concept that, for the last 20 or 30 years, the hospital and community care and primary care sectors have been gradually digitizing. I think really the first kind of, big steps towards it, I guess, were taken in the 60s when hospitals started to kind of begin to put their patient admin systems on computers. And since then, we've kind of developed through several generations where we now have, it would be amazing to find a large hospital that doesn't have a fairly comprehensive electronic patient record, patient admin system, and various clinical systems within it. So that's all pretty well taken care of. And the same pretty much goes for the community and primary care sectors. But And at the national level, of course, a lot of countries now are saying we need an EHR infrastructure to tie all this together, because there's no point having your health record in lots of different places, which it is today, lots of different EPRs, when what you really want to do is to have it all together in one view of your health episodes. So there are now, things like unique identifiers, national care records, out-of-hours services, image archives for PACS being created by individual countries. But over here, this is kind of where, this is where the patients actually spend most of their time. They're not really in this part of the world. They're in the home, the office, the mobile environment, and they're doing other things. And what we think needs to happen here is much more coordination between, if you like, the personal health world, the edge of the network, and the various services that already exist today. So some hospitals, for example, now are starting to open up their electronic patient records to their customers. You can, if you belong to Duke University Hospital in the States, or I think also Kaiser Permanente, you can actually go in and view your health records from home if you wish to. Similarly, there are now ways of starting to gather information from these EPRs at a national level and then making those available to the individual citizen. So I think we're going to see far more joined up connections between this world and the kind of the more traditional e-health worlds here. So let's talk about just different categories of things that happen. I've divided it really into kind of two kind of types of categories and then two subsections within that. What I've called self-directed and guided by clinical care and needs. Under self-directed, we've got the inform, educate category of services on e-health services. So things like news and consumer sites. As I've mentioned already, a lot of people do go to the internet to find information about healthcare. There are now a burgeoning number of healthcare issue-related websites, that specialize in particular diseases or concerns. There are patient groups websites. There are charity websites for different conditions. And there are now government-provided healthcare information portals that, again, attempt to give you both good health advice and also some idea about the choices you have when it comes to selecting from what they have to offer. And this is kind of a passive, self-directed activity in that you're simply going and looking at stuff, you're reading stuff off the web. There are also, in the more active sense, connect and relate services. So we've now got, extensive use of communications vehicles like email, blogs, and wikis for people that are suffering from a condition and now want to basically get online and share their experience with other people. I want to talk about that in a second. We've also got an interesting development of social networking sites being used for healthcare. So if you go to Facebook